Hi Jimmy, my name is Adni, and I'll be the nurse responsible for taking care of you today. First up, is there any unbearable pain you're experiencing at this present time?
The pain in my legs is excruciating. Is there anything you can do to help with the pain?
I'm sorry to hear that. However, the responding paramedic had already given you painkillers to ease your pain. I believe I cannot give you any more medication at this moment. My role is to tend to your needs in order to make this experience as less painful as I can. I familiarized myself with the injuries, and through assessing any vital signs, I have been able to stabilize your current condition. In saying that, I'll be taking care of medicine administration, monitoring your health, and keeping you up to date with any new health developments. I will also be working along a collaboration of various health professionals. Therefore, I have referred my findings to the medical imaging technician, who will be here shortly to further examine you and explain your injuries. If you have any concerns regarding your family and your health, please feel free to ask.
I'm just worried about my family. When will I be able to see them?
I can assure you that your family is in good hands. They are being taken care of by a number of health professionals working together. Our team of health professionals are very conscious of any cultural differences and have been trained to respond in accordance to any cultural concerns. Once your family's injuries have been assessed and they have been cleared, you will be able to reunite with them.
As a nurse, cultural awareness is an important factor in doing my job. Because I interact with many individuals from all walks of life, it is important that I am sensitive to any cultural clashes and/or barriers. Jimmy is an Indigenous man, and therefore it is critical that I am aware of his cultural values and morals in order to avoid any cultural offense. My ability to assess cultural, ethnic, or racial differences in patients stems from the principles and fundaments of the Geiger and David Heiser transcultural assessment model, where it focuses on the significance of cultural competency that nurses need to display.
My name is Erin, and I am your medical imaging technologist. I take care of all your x-rays and scans to help identify your injuries. We did an initial trauma series of x-rays earlier today to check your spine, chest and pelvis, just to cover the main areas of concern. We have also x-rayed both of your legs, and both present with some fractures in the lower areas, which will need to be surgically pinned. Educating the patient on their condition and the treatments required allow the patient to make an informed decision about their healthcare throughout their hospital journey. It is important to communicate the extent of the patient's injuries effectively, as they may not understand the technicalities as well. We would like to do a neck and head CT scan because you did have a lapse of consciousness during the crash, and we'll do that now, and after that you'll go in for surgery. Would you be okay with that?
Yes, that's okay.
Getting the patient's consent is very important, as patients have a right to refuse or discuss other options. This is an important step in making the patient feel they have a say in their healthcare throughout their hospital journey and ultimately builds trust. We will work with the pharmacist regarding the administration of antibiotics for your staph infection, and we will also work with the podiatrist to get you rehabilitated. Working in an interdisciplinary environment increases the chances of better patient outcomes, as the professionals from one department can gain advice from another department as to how they can reach their patient's healthcare goal. Redesigning the process as a team to simplify the process has also been proved effective, especially when it comes to involving the patient in their hospital journey.
Good morning, Jimmy. I am Jess, and I will be your podiatrist for the duration of your treatment. So as you know, the on-site paramedics did what they can and realigned the fractures, as well as tending to the lacerations to your lower legs. However, I've also caught up with Erin, your medical imager, and assessed the extent of your injuries. Yes, she said I will have to go into surgery? That's right, your outstanding fractures to your lower legs will have to be pinned and plated. After this, you will begin ongoing podiatry care with me, where we will focus on the strengthening and rehabilitation of your feet and legs. When will this happen? Once you come out and recover from your surgery, we can discuss and create a plan that is tailored to you in order to increase the chance of a smooth recovery. What kind of things will we focus on? Everything to get you back home and coaching your under-7s rugby team. To do this, your program will include a long-term focus on issues surrounding your ulcerated right leg and prevent the continuation of a limp while walking.
Hey Jimmy, it's nice to meet you. My name's Jalan, and I'll be your pharmacist during your stay at hospital. Could I get you to rate your pain for me on a scale of 1 to 10?
It's not too bad right now. Maybe like a 3 or a 4?
Perfect. So at the moment, we just have you on some basic pain medications, Panadol and oxycodone. I'll be consulting with your nurse in regards to the recommended dosing and administration. If you ever feel your pain levels are becoming unbearable, just let us know and we can put you on some stronger analgesia such as morphine. Now, as you have been diagnosed with a Staph aureus infection, it's important that we have you on an antibiotic medication. However, with this type of treatment, there is a chance that the bacteria could develop a resistance to the antibiotics, which in the worst case scenario could lead to us having to amputate in order to prevent a systemic infection. Don't worry though, I'll be monitoring you closely and working with your doctor and nursing team to ensure a successful treatment. As you will be stuck in bed for some time, your risk of forming a blood clot is also increased. I'm going to be putting you on a blood thinner called heparin, which will help prevent the development of deep vein thrombosis.